Government Ayurveda Medical College, Mysore recently had the honor of hosting a landmark contained medical education program exclusively designed for the esteemed teachers of Samhita and Siddhanta. This impactful event, organized by our Department of Ayurveda Samhita and Siddhanta, was made possible through the generous sponsorship of the Ministry of AYUSH, Government of India, with the support of Rashtriya Ayurveda Vidyapeetha, New Delhi. We are delighted to share the complete recording of this week-long academic journey. Watch now to gain valuable insights from our distinguished speakers and relive the spirit of knowledge sharing and academic excellence.
Now, the session is led by Professor S.Swami Natan, an eminent Ayurveda physician and academician from Tamil Nadu, has over 30 years of teaching and clinical experience. He is a professor at Sri Jayendra Saraswati Ayurveda College, Chennai, and Dean at SCSVMU University. He holds a BAMS and PhD in Ayurveda and Sanskrit. A prolific author, he wrote the acclaimed Tamil series Ayulkakkum Ayurvedam and has delivered 100 plus lectures globally. His awards include the Deccan Dhanvantari Award, Bhishak Ratna Award, Vaidya Seva Ratna Award, Lifetime Achievement Award. A dedicated educator and public health advocate, he continues to promote Ayurveda through research and outreach.
My pranams to the principal of this government college. My pranams to Chate sir for inviting me on this wonderful session on our OTP. Good morning to all of you. Esteemed colleagues, physicians and researchers, it is a distinct honor to stand before you today to delve into a topic that lies at the very heart of Ayurveda pathophysiology. For those of us in the clinical and research fields, our daily work is a quest for understanding, a quest to unravel the complex journey from health to disease. We seek models that are not only descriptive but also predictive and, most importantly, clinically useful. So let me go to the slide now. Next one, please. Yes. Today, we will explore one such model. We will embark on a journey through the foundational axis of Ayurveda, understanding of the human body, the intricate, interconnected relationship between Kosha, Agni, Srotas, Doshagati and Rogamarga. These are not merely 5 separate concepts. They form a single dynamic and logical chain of events, a pathophysiological axis that explains how a simple imbalance in the gut can over time manifest as complex systemic disease. Our goal today is to deconstruct this axis, understand each component and then reassemble it to see how it provides a powerful framework for diagnosis, prognosis and highly personalized treatment. We'll go to the next slide here. Our discussion will be structured in 3 parts. First, we will establish the physiological bedrock, the foundational triad of Kosha, the container. Kosha is called the container. Agni, the transformative energy within it, and Srotas, the transport network. Second, we will explore the dynamics of how things go wrong, examining the concepts of Doshagati, the pathological movement of morbid factors, and Rogamarga, the pathway they take. Finally, we will bring it all together, synthesizing these concepts into a unified model of pathogenesis and applying it to 3 distinct clinical case studies. Let us begin with the foundation. Next slide, please. Yeah. Before we can understand the pathology, we must first appreciate physiology. Ayurveda possesses that homeostasis rests on 3 pillars: the body's central processing unit, the energy that powers it, and the channels that distribute the products. These are Kosha, Agni, and Srotas. Coming to the next slide, the concept of Kosha. Yeah, correct. The first concept, Kosha, is a cornerstone of Ayurvedic diagnosis, yet its full scope is often underappreciated. It is much more than that, just an anatomical space. Anatomically, yes, Kosha refers to the great hollow cavities of the body, the thoraco-abdominal space that houses our vital organs, the Kosha Angas. The classical texts from Charaka to Sushruta lists organs like the heart, the liver, spleen, kidneys, and the entire alimentary canal as being part of the Kosha. Sushruta beautifully defines it as the site of undigested food, digested food, urine, and blood, the body's central processing one. It is called the core. This anatomical space is also referred to as the Abhyantara Rogamarga, the internal pathway of disease, and the Srotas, the great channel from mouth to the anus. But the true clinical genius of the Kosha concept lies in its physiological function. Functionally, Kosha describes the inherent motility and reactivity of an individual's gastrointestinal tract. It is most clearly observed and assessed through a person's lifelong bowel habits. In this sense, Kosha is a direct, tangible expression of an individual's unique constitutional balance of the dosha, Vata, Pitta, and Kapha. By simply understanding a patient's Kosha, we gain a profound insight into the functional tendencies of their gut, their metabolic state, and how they will respond to food, medicine, and critically to our therapeutic interventions. Coming to the next slide, please. Based on the dominant dosha influencing the gut, we classify Kosha into 3 primary types. First, we have Krura Kosha, which translates to a hard or irregular bowel. This type is dominated by Vata dosha. The inherent qualities of Vata, dryness, roughness, and coldness, manifest in the colon. This leads to increased water absorption from the stool, resulting in feces that are hard, dry, and difficult to pass. Individuals with the Krura Kosha often suffer from irregular bowel movements, bloating, gas, and chronic constipation. I'm sorry. So people come to us with a chronic constipation problem based on tatra ruksho lagushita karaha sukshmastalo anilaha, resulting in that way, and they come and complain us about the bloating, gas and chronic constipation. From a therapeutic standout, they are hard to purge. They are called as hard to purge. They require strong, drastic, purgative substances, for example, Mishraka Sneham for diabetic patients, to achieve an effective therapeutic cleansing. Second, the Mridu Koshta, the soft or sensitive bowel. This type is dominated by Pitta dosha. The qualities of Pitta, we all know that Pittam Sasneha Dekshnoshtam Laghuvisram Saram Dravam, and create a hyper metabolic and a highly secretory gut environment. This leads to stools that are soft, semi-solid or even loose, while with a tendency toward frequent bowel movements. These individuals are highly sensitive to laxatives. You cannot give Abhipatti Churnam, Trivrat Lehyam, Mani Bhadram and all that. When we give, we have to give with great care. And the texts state that they can be purged by something as simple as a glass of hot milk, some ghee or a handful of grapes. Enough, no? A small grape you put in the hot water, resins. Next day morning you people purge. There is a medicine called Kalyanaka Gulam. It removes gas and constipation. But very careful we have got to be. They are easy to purge. Vata Koshta is hard to purge. Pitta Koshta is easy to purge. And third, we have Madhyama Koshta, the moderate or normal bowel. This is associated with the predominance of Kapha dosha, or ideally a balanced state of all the three doshas. The unctuous and stable qualities of Kapha, Snigdhashito Gurur Mandaha, Slakshno Mritsna Sthira Kapaha, of Kapha promote regular, well-formed stools that are passed smoothly and without difficulty. This is considered the healthiest type, representing a state of equilibrium. These individuals require moderate strength purgatives for therapeutic cleansing. So we go to the next slide, please. Yes. How do we determine a patient's koshta? So how do we assess this in a clinical setting? Traditionally, it is done through interference. We use Prashna Pariksha or patient's interrogation. We ask detailed questions. How often do you typically pass stools? Are they usually hard or soft? Do you need to strain? Such questions we ask the patients. Is there a feeling of complete evacuation? We also ask how their bowels react to the specific food items. Does a glass of milk at night send them to the toilet in the morning? This simple question can be a powerful differentiation between Mridu and Krura Koshta. Many people take Triphala at night bedtime. It is said Triphala Matasarpibhyam Nishi Nettarabalaya Swasthya Anuvritti Krityacha Roga Uchetakaram Chayata Ashtanga Kridayam. Wonderful line to quote. In fact, I gave this medicine, an allopathic doctor got totally cured. And you know that she practices Triphala to every patient. We cannot practice allopathy, they practice Ayurveda. Surprising. And coming to this point, in cases of uncertainty, a small therapeutic test can be used. During the preparatory phase for Panchakarma, the number of days required for proper minimal oleation or Snegapana is a key indicator. A Krura Koshta patient may take up to 7 days to show the signs of saturation. Samyak snigdha lakshanam. Deepta agnihi, parchaha snigdhaha asamhatam, sneha udvegaha, klamaha, samyak snigdhaha, all that we have studied. And a Mrudu Koshta patient may show them in as few as 3 days. In an effort to standardize this assessment, modern researchers have developed tools like the Koshta deciding scale. Nowadays it has come now, or KDS it is called. This scale formalizes the traditional questions into a scoreable format, assessing the frequency, consistency, straining, and the effect of simple substances like hot milk. This is a valuable effort to bridge classical wisdom with the objectivity of modern clinical research. The dual definition of Koshta as both structure and function is a perfect illustration of Ayurveda's integrated view. The anatomical Koshta is the stage. The physiological Koshta is the performance that takes place upon it. By observing the performance, the simple, tangible act of bowel elimination, we can infer the state of the subtle internal forces of the doshas, and as we will now see, the state of the body's central fire. This brings us to the second pillar of our foundational fact, that is Agni. Coming to the next slide, please. Next one. Yes. If Koshta is the container, Agni is the transformative fire within it. In the Ayurvedic paradigm, Agni is the supreme principle of transformation. It is not just stomach acid. It represents the entirety of the body's metabolic capacity. Every enzyme, every hormone, every biochemical process that breaks down the substances and rebuilds them into fire, into life also. The state of our Agni is considered the single most important determinant of our health. Acharya Charaka states this with a profound clarity. He says that longevity, complexion, strength, health, enthusiasm, immunity, that is ojas, energy, tejas, and the vital life breaths are all dependent on the bodily fire. Agam Vaishwanaro Bhutva Praninam Dehamasritam Prana Apana Samayuktaha Pachami Annam Chadurvidham Diksham Dehi Kripa Valambanagari Mata Annapurneshwari. Annapurnashtakam of Adi Shankara, if chanted before taking the food, your fire is protected. And Lord Krishna in Bhagavad Gita says that it is me who reside in all human beings as fire. Agam Vaishwanaro Bhutva. That is why we have a churnam called Vaishwanaram Churnam. This, it is the fire element which stays. That is why when you touch a a dead body, it is very chill to touch because the fire has gone out. So Jadharagni is the center point for life. That is why Ashtanga Hridayam quotes 9 commandments. To protect the fire, Prasrishte Vinmutre, Hriti Suvamale, Doshe Supadhake, Vishuddhe Udgare, Kshut Upagamane, Vate Anusarati, Tatha Vagna Udriktaha, Vishada Karane, Dehe Sulaghav, Prajunjitaharam, Vidhiniyamitam Kalaka Sagimataha. People who follow these 9 commandments, they live for a long time. It is not that you do exercise and all that. Just to look into this 9. And Acharya, Lord Krishna says, it is me who digests all the eatables, lickables, drinkables and chewables in the human body. So let us consider that Agni is the most important one. Therefore, we say that Acharya continues to comment that he goes on to say that when this fire is extinguished, we die. We all know that Shante Agno Mriyate Chiram Jivat Yanamayaha Rogi Syat Vikratehe Moolam Agnis Tasman Niruchate. And when it is disturbed, we fall ill. Therefore, Agni is the moola, the root of life itself. This is a powerful statement. It possesses that the integrity of our metabolic system is the prerequisite for health, and its failure is the initiation of all pathology. Next slide, please. Yes, correct. Ayurveda describes a hierarchy of 13 types of Agni, categorized into 3 groups. At the top of this hierarchy is Jadhara Agni, the central digestive fire. Tatrastameva pittanam seshanam anugraham karoti. This is the master fire located in the gastrointestinal tract, primarily in the duodenum and small intestine. It is responsible for the initial gross digestion of food, breaking it down. Now, just now we all had breakfast. Now the breaking down is going on. And into a nutrient essence. That bun is also getting into a nutrient essence, known as Ahara Rasa, and separating it from the waste products. The health of the entire organism depends on the balanced function of this master fire. Next are the 5 Bhuta Agnis, the elemental fires. These correspond to the 5 great elements: earth, water, fire, air and ether. This stage of metabolism is often correlated with the functions of the liver. You might have come across a sloka, na? Panja bhutatmake dehe ahara pancha bhautikaha vipakvam panchadha samyak swan gunan abhivardhayet. A wonderful sloka. I don't know from where I am quoting it. Things come like that. From where? Srotas Samhita. Okay, thank you. And also, Charak also confirms that. Okay. So, next, the Bhuta Agni. These correspond to the liver. The Bhuta Agnis act upon the Ahara Rasa to further refine it, transforming its elemental components into a state that can be assimilated by the body's tissues. Finally, we have the 7 Dhatwagnis, the tissue level fires. Each of the 7 bodily tissues or dhatus has its own specific Agni. Rasagni for plasma, Raktagni for blood, Mamsagni for muscle, and so on. Down to Shukragni for reproductive tissue. Each Dhatwagni is responsible for metabolizing the nutrients supplied to it and building its own healthy, mature tissue. This sequential process, known as Dhatu Parinamam, ensures the systemic nourishment and regeneration of the entire body. Coming to the next slide, please. Yes. The ideal state is Samagni, or balanced fire. Tair bhavet vishamastikshno mandaschagnihi samaihi samaha. This is associated with the balanced state of the doshas. Food is digested and completely and on time, leading to proper nourishment and robust health. This state is associated with the Madhyama Koshta, not with Vishama or Manda and Tikshna. Then we have Vishama Agni, or irregular fire. caused by the influence of Vata dosha. The erratic nature of Vata makes the digestive fire unpredictable. Sometimes it is strong, causing intense hunger. Other times it is weak, leading to indigestion, gas and bloating. So whenever you take, please take care, when you take Haldiram's moong dal, take care that you don't increase your gas. That will definitely increase. Any dal item in cold form, dal sambar, for example, it will increase the gas. You have to take Vayu Gudika. You travel across the whole Kerala, na? Every house people take Vayu Gudika with warm water. So, this is a wonderful way of living, no? Many of us forget that by increasing the gas. They put all crackers. They make sounds, even A.R. Rahman has not put such musics. So, coming to the next one is the Tikshna Agni. So, whenever you push inside a small, what you call Pani Puri, please take care. Your Tikshna Agni will increase. Your Agni will increase into Tikshna. Pani Puri, look at that green water now. Oh God. I don't know how people open up that mouth so much and push in the small puri. And your masseter muscle will get into trouble. So, next is Tikshna Agni. The sharp or intense fire caused by the predominance of Pitta dosha. The intense heat of Pitta makes the digestive fire overly powerful. Food is digested very quickly. It is called Bhasmaka Rogam, leading to symptoms like hyperacidity, heartburn, and intense growing hunger. This state is directly associated with the Mridu Koshta. The best medicine for this, I normally tell my patients, is that you put a little resin, raisins, or what you call draksha, with a little, what you call that, rose bud in hot water. The whole night you soak it. Next day morning you drink the water. You will have 3 to 4 times hoya hoy. Then people ask, what is hoya hoy, sir? That is in the toilet only. Hoya hoy will happen. So you will have a purging. But that day you should not go to office. Because on the way something may happen. The 5th time may come. So that fear is also there. So preferably on a 2nd Saturday or 4th Saturday. Unfortunately, one family, all the members took in the same day. And only one toilet. They all suffered a lot. Draksha? Along with the rosebud. Rosebud. Yeah, rosebud is there now. Before it blossoms. That is a wonderful item. And so, finally, and most importantly, from pathology, we have Manda Agni, the slow or dull fire caused by the influence of Kapha dosha. The heavy and cold qualities of Kapha. Please take care. What do you call that? Payasam? Is it common name in India? Yeah. Payasam, when you drink, take care. Especially when it is given free of cost. We go out of way and take it. Manda Agni will form. The heavy and cold qualities of Kapha suppress the digestive fire, making it sluggish. This leads to a weak appetite, slow digestion, and feelings of heaviness. Manda Agni. This state of diminished metabolic capacity is cited in the text as the root cause of almost all diseases. The best item to improve upon the Jatara Agni is take a little lemon juice, add a little ginger juice in that, add a little honey in that, add a little rock salt in that, make it into a nice linctus, and then just put in the mouth and take. Please advise your patients. It is said in the 1940s, Ayurvedic scholars have written that formula, and it works wonders. Lemon juice, ginger juice, a little sendha namak, little rock salt with a little honey in that. It appears a beautiful syrup now. The Mandagni will come to Sama Agni. Continue that, it will become Tikshna Agni. So that is dangerous. And because people love to take that. The taste is wonderful. Okay. So, how do we assess Agni? We look for the signs of properly digested food. The Jirna Ahara Lakshanas. Can anyone quote that from Ashtanga Sangraham? Udgara Shuddhir Utsaho Vega Utsargo Yadhojitaha Laghuda Krutpipasacha Jirna Aharasya Lakshanam. Ashtanga Sangraham only quotes that line. Udgara Shuddhihi. The belching should be clean. Utsaha. You take your plate and run to the mess hall to take the food. Vega Utsargo Yadho Uchitaha. Go to the toilet. Motion and urine are going free. I wonder at a cow now. The cow without any application of force, it goes normally. But humans suffer in the toilets. In fact, we have a good specific gravity also. In spite of that, we suffer. So, that's what Jirna Aharasya Lakshanam. These include enthusiasm and energy, a feeling of lightness, laghuta, of the body, and a clear belching, the timely return of natural hunger, yatho uchitaha, and proper timely elimination of waste. The absence of these signs points to a derangement of Agni. When you don't have any one of these lakshanas, please skip the meal, is the advice. And it is said that, the absence of these signs point to the derangement of Agni. And as we have seen, the patient's Kosha type gives us a direct and reliable clue to their inherent Agni state. Coming to the next slide, please. Yes. Ushmano alpa balatvene dushta mamachayagatam. Can you continue for the next 4 slokas? Anye doshebhyeva atituштebhyo anyonna murchanat kodravasya vishasyeva vatanti amasya sambhavam. So, coming to the next point, now we come to a pivotal concept in pathogenesis. What happens when Agni fails? The consequence is the formation of ama. When Jatara Agni is weak, it cannot fully digest the food. This undigested or improperly processed food residue stagnates and ferments in the gut, forming a sticky, toxic, morbid substance called ama. In fever we have studied, na? Amena bhasmana iva agnau channe annam na vipachyate tasmat adosha pajanat joridan upavasayetan. Why upavasam is indicated in jwara? Because ama is covered with the food. Tivrartirapi na ajirni pibel shulaghanam aushatam amasanno analo na alam paktum dosha aushadashanam. Vagbhatacharya beautifully quotes. Every word is to be taken into the heart. And ama is the metabolic toxin that obstructs the channels, vitiates the doshas, and is considered the primary seed of diseases. The entire Ayurvedic model of pathogenesis is in essence a story of metabolic failure. A weak Jatara Agni produces ama. Thus, ama-laden nutrient fluid then overwhelms the Bhuta Agnis in the liver and the Dhatva Agnis in the tissues. This leads to the creation of weak, immature and vitiated tissues which become fertile ground for disease. That's why Acharya is very careful. Pachanair deepanaihi snehaihi swedaischatan parishkritani. Very important sentence he brings in there. This elegant cascade directly links the health of our gut to the structural integrity of every single cell of our body. We now have the container, the Kosha, and the transformative fire within it, Agni. But for the body to function, there must be a transport network. This brings us to our third foundational pillar, the Srotas. Next one, please. Yes. Go next one, please. Yeah, okay. Before that, correct. See, for the word Sanskrit in Srotas, it is called Sru. Yeah. The concept of Srota describes the body's vast and intricate network of channels. The word comes from the Sanskrit root Sru, meaning to flow. These are not just physical tubes like arteries or intestines. The concept of Srotas encompasses any space through which movement or transport occurs. From the macroscopic respiratory tract to the microscopic pores of a cell membrane. Charaka states that the human being is in essence an aggregate of these channels, as all life processes, physiological and pathological, happen within them. Next one, please. Yes, you all know that from Vimanasthanam. For clinical purpose, the text describes 13 principal Srotamsi. Each Srotas is defined by the substance it carries and is governed by one or more. Moolasthanas or roots, which are the primary organs that control it. Let us briefly review some of the most critical ones. I am not going to the all one. The Pranavaka Srotas carries out the vital breath or prana. Its roots are the heart and the great channel of the GI tract. The Annavaka Srotas carries food. Its roots are the stomach and the left flank. The Udagavaka Srotas transports water and fluids. Its roots are the palate and the cloma, an organ often correlated with the pancreas or oropharynx. The Raktavaka Srotas carries blood. Its roots are the liver and spleen, our primary hematopoietic and blood filtering organs. The Purishavaka Srotas carries the feces with its roots in the colon and rectum, and so on for each of the 7 tissues and the other waste products. The integrity of this vast network is essential for health. Disease arises when these channels become dysfunctional. This brings us to the 2 critical and often confused concepts, Kavaigunya and Sroto Dushti. Understanding their difference is vital for a sophisticated approach to both prevention and treatment. Next slide, please. Yes. Kavaigunya literally means a defect in a space or channel. Kavaigunyam is a defective in a space or channel. It represents a pre-existing weakness, abnormality or susceptibility in a particular srotas or tissue. This can be congenital, a genetic predisposition, or it can be acquired through poor diet, lifestyle or a previous illness. Kavaigunya is the fertile ground for disease. It is a state of vulnerability, but it is not the disease itself. It is the weak spot. Vitiated doshas may circulate throughout the body, but they will only settle and cause disease where they find a site of Kavaigunya. Correcting these weak spots is the essence of preventive and rejuvenating medicine or rasayana. This we have studied in elaborate details in Charaka Samhita, how to treat that. We all know that prasaram sthana samsarayam vyakti anbhedam. Sthana samsrayam of the dosha happens, that is dosha dushti, and sthana samsrayam, where they get located, becomes the Vaigunyam. Sroto dushti, on the other hand, is the active vitiation or dysfunction of a Srotas. This is what happens when the disease process actually begins. It occurs when aggravated doshas circulating through the body find a susceptible channel, a site of Vaigunya, and lodge there. That is why people come to us with the liver abscess or PCOD and all that. This initiates the pathological interaction, the dosha, doshya, samurchana, that creates the disease. The interplay between Vaigunya and Sroto Dushti beautifully explains a key clinical observation. Why do two people exposed to the same disease causing factors develop completely different illnesses? The answer lies in their unique individual landscape of internal tubes. Imagine two people with both consume a heavy oily diet that aggravates kapha dosha. Person A has a constitutional weakness in their respiratory channels, a pranavaga srotas, Vaigunyam. Person B has a weakness in their channels of fat metabolism due to a sedentary lifestyle. Then a Medovaka Srotas Vaigunyam for them. The aggravated kapha circulates in both. In person A, it lodges in the susceptible respiratory channels, causing Sroto Dushti that manifests a congestion and followed by asthma. In person B, the same aggravated kapha settles in the compromised channels of fat metabolism, causing Sroto Dushti that manifests as weight gain and eventually perhaps diabetes also. So it is said that Karshameva varam sthaulyatam naki sthulasya bhedajam. The same cause produces two different diseases. Cause is one, two diseases are happening based entirely on the location of the pre-existing weakness. This is the heart of personalized medicine in Ayurveda. We treat not just the disease, but the unique individual who has the disease. So we have to look into Shukrartavasthair Janmatam, Dushyam Desham Balam Kalam, Analam Prakritim Vayaha, Sattvam Satmyam Tadaharam, Avastascha Pradakvidahar, Yo Vartade Jigitsayam, Nasas Kaladi Jadujat. It is stated in Ashtanga Hridayam. And the same cause. So far, we have built our physiological foundation. Kosha, the reactive gut. Agni, the metabolic fire. And Srotas, the transport network. Now, let us explore the dynamics of how this elegant system breaks down. Coming to the part 2, the dynamics of pathogenesis. Sampraptihi, yatha dushtena doshena, yatha cha anuvisarpada, nirvarti ramayasyasau, sampraptir jatiragatahi, madhava nidanam, nidane madhavasreshtaha, sutrasthane tu vagbhataha. And with our physiological framework in place now, we now shift our focus to samprapti, the Ayurvedic term for pathogenesis. This is not a static event, but a progressive sequence. To understand this sequence, we need to grasp two more critical concepts, Doshagati and Rogamarga. Coming to the next slide, Doshagati. You have moved to the next one, no? Doshagati, yeah. The movement of morbid humors. Doshagati is a concept that describes the behavior, the state, and most importantly, the movement of the doshas. Gati means movement or path. There is a normal physiological movement of the doshas, the prakritaka gati. We have studied na tayo vriddhis sudhamnyeva pridvesho vriddhihetushu viparita gunecha cha kopastu unmarga gamita linganam darshanam svesham aswastyam roga sambhava. And also that sloka na chaya prakopa prashamaha vayo grishma dishu trishu varshadishu tu pittasya sleshmanaha shishiradishu. Wonderful concept. But aharad vashat, it can happen anytime, anywhere. Then Ritucharya is not taken into account there. So, that is what he is going to tell here. This includes the naturally daily and seasonal cycles that maintain health. But when the doshas are disturbed, their movement becomes pathological. This is Vaikrita Doshagati. We have studied now. What is the sloka? One good sloka is there in Ashtanga Hridayam, in Sangraham also. Vyayamat Ushmanas Taikshnyat Akita Acharanatapi Kostal Shakasti Marmani Dhritatvan Marudasya cha Dosha Yanti Tada Tebhya Sroto Mukha Vishodhanat Prithvi Abhishyandanat Pakat Koshtam Vayoscha Nigrahatam. After coming to the Koshta, Te Kaladi Balam Labdva Kupyam di Anyasreshapi Tatra Anyastana Samsteshu Dadiyam Abaleshutu Kurya Chigitsam Swameva Balena Anyavi Bhavishu Agantum Shamayed Dosham Sthaninam Pratikrityavan. If you know the heart of the meaning of this sloka, we put it in practice. Wonderful results will come. And in this concept, he is telling that the gati, the movement of the doshas, and the Vaikrita dosha gati, and it is the driving force behind the entire disease process. The classical texts classify this pathological movement in several clinically useful ways. First off, by quantity, that is kshaya, sthana and vriddhi. This you have to understand. Kshaya is a decrease or depletion of a dosha. We treat this by nourishing. When vayu decreases, we give tatra, what you call that? Astini sthito vayu. So, when a patient comes to us with vayu less in the body, we give vayu akasham as aharam, viharam and aushadam. And then lift it up, like Jesus Christ pulling up the Peter who was drowning. Like that. So you make it up, then that is not called Brahmanam. Brahmanam is Prithvi and Jalam na. Because we have studied na, tatra, what you call, Astini sthito vayuho pittam tu sweda raktayoho sleshma sesheshu tena yesham asraya asrinam mitaha yadu ekasya tad anyasya vardhana kshapanaushadam prayo vriddhirihi tarpanat sleshmana anugata asmadija. And we have studied that amba prativibhyam sleshma agneyam pittam vayu akasha dhatubhyam vayuhu. So when people come to us with the prithvi and jalavikaram, we give Agni, Vayu and Akasham as aushadam. That is Ayurveda. Very simple. Why do we give Trikati Churnam for a Kapha Vriddhi case? Prithvi and Jalam are more. You give Agni, Vayu, Akasham as aushadam. And why do we give Trikati Churnam after Bhojanam? Vayoho Ratri Bhuktanam Te Antamadhyadikaha Kramatam. So, at the end of the meal, kapham will become avasthapakam, nishtapakam. We have studied na. Peni bhutam irayetam. At that time only we do tambola sevanam. We take Trikati Churnam. Wonderful concept of linking of Samhita Siddhanta with the Chikitsa. Chikitsa cannot exist without Samhita and Siddhanta. Definite. And so, Acharya goes on to say that Kshaya is a decrease or depletion of a dosha. We treat this by nourishing and replenishing it. Sthana is the normal balanced state. Vriddhi is an increase or aggravation. Karshya, Karshnya, Ushna, Kamitva, Kampa, Anaha, Shakrit Grahan, Bala, Nidrendriya Bhramshaha, Pralapa Brahmadhinataha, Pita, Vinmutra, Netratwang, Daha, Alpa Nidradaha, Pittam, Shvaitya, Shaitya, Shladhangatvaha, Sandhivanda, what is it? Shwasakasa, Ati Nidradaha. Thank you. Sometimes you forget slokas. Yeah. So, vriddhi is an increase or aggravation. This is when a dosha overflows its primary site and begins to cause diseases. That is called unmarga gamitvam. And we treat this by pacifying it, or if the aggravation is severe, by eliminating it from the body. Second, this is the first, that is based on quantity. Coming to the second direction is called urdhvagati, adhogati and tiryagati. Doshas can move. Urdhvagati is the upward movement leading to conditions like vomiting. And the best medicine for vomiting is lajas chardignanam. Please look into the Jara Chikitsa. Prak lajaveyam, sujaram, shushundi dhanya pippalim. A girl got discharged from Apollo hospitals in Chennai. The doctors could not stop her vomiting. Even after giving what you call that perinom injections and all that. No. Then the girl was brought and then they asked me what to do. I said, Prag Lajapayam, Sujaram, Shushundi, Dhanya Pippali. Then they asked me, what are you telling? I'm quoting a sloka, please. I'll tell you the meaning of that. So that Laja, you prepare one Mandapeya Vilepi Vadananam Chalagapam Yadhapurvam Shivastatra Mando Vadanulomanaha Kritana Vargaha. So you prepare one mandam with Laja, with a little Dhanya Pippali. And see, within 3 shots, within 3 mandam, the girl became all right. Vagpadacharya tells only the truths. And for vomiting cases, we should not forget Jiraka Bilvadi Lehyam, Jirakadya Arishtam, or Laja as the best medicine. Adhogati is downward movement leading to conditions like diarrhea. When diarrhea happens now, I have a patient from Spain. This boy went to Spain and he had all his non-vegetarian items there and he has come down with IBS now. It is called Pravahika, we can say. Vayu pravurdho nichitam balasam nutati adhasta dagidashanasya. So Pravahika, the best medicine is Balabilvam Gudam Tailam Pippali Vishwabhedajam Lihyad Vade Pratikate Sashulassa Pravahika. I tried on that. On him, he is all right now. IBS cannot be cured that simple, I tell you. You have to take Bala Bilvam. You have to break open the shell. That inside that, you have to add a little jaggery, gingerly oil. Why gingerly oil? Tailam soyonivat tatra, mukhyam tekshnam vyavayicha, baddhavitkam, krimignam cha, samskarat sarvaroga jittam. Krishanam brahmanayalam, Sthulanam Karshanayacha. You can use gingerly oil alone in your practice left and right. The reply will come from the patients. You look into the Taila Vargaha of Ashtanga Sangraham or Hridayam. He quotes wonderful concepts related to clinic practice. And coming to this point, and most critically for chronic disease, there is a Tiryagati. This is an oblique or transverse movement where vitiated doshas move from their primary home in the koshta to the central gut, sideways into the shakha. Shakha raktadayastvaksha bahya rogayanam hitat tad ashraya mashavyanga ganda lajya arbudadaya bahir bhagascha durnama gulma shobhatayo gataha. Movement of doshas from Kosha to Shaka, and it can happen only in 5 ways. Vyayamat, Ushmanastaikyat, Agita Acharanadapi. Kostal Shakasti Marmani, Drutatvan Marutasya cha. By the pushing of Samana and Apana Vayu, the doshas move from the Kosha to the Shaka. Bringing them back to the Koshtam is Vriddhi. Koshtam Vayostya Nigraha. After bringing them to the Kosha, Nyatva Kosha Prapannamscha Yatha Sannam Vinirharetana. You have to choose the nearest route of elimination. And so, you delay that, then they kaladi balam labdva kupyam the anyasreshapi. Again they will go to other places of the body. So, shodhanam is very important than shamanam. And you go to the Veganna Dharayed Adhyayam, he says that kramat apankepi manav panko avashyam bhavatyataha uttishteta yatha kalam malanam shodhanam pratin. Wonderful quote of Ashtanga Sangraham. Even you wear a precious gem, you can see ladies wearing a stud and all that with a diamond and all that. After some time, oil may get inside. You have to remove the diamond, clean it, and then again put it back. Same way in our body also, that dosha get accumulated, and so we have to go for periodical cleaning. That's what Acharya says, Shitotbhavam doshajayam vasante vishodhayam grishmayam abhragale ghanatiye varshikam ashu samyak prapnoti rogan rutujan najatun. That is related to Rutus. Rutus are not happening in India. I think except in Haryana, it is somewhat, it has gone very now. Anyway, look at the patient. I tell you that Rutucharya is not something out. It is inside the body only. We are the Rutus. We are only representing all the aspects. And, okay, coming to the next point, please, Rogamarga. Have you put Rogamarga? Okay. The Rogamarga, it literally means the pathway of diseases. It represents a specific route or a trajectory that a disease process follows within the body. While Doshagati is the dynamic force, Rogamarga is the resulting location where the pathology manifests. The texts classify these pathways into 3 main categories based on the anatomical location and the depth of the disease. First is the Bahya Rogamarga, the external pathway. This corresponds to the Shaka, the peripheral and superficial structures we just discussed. It includes the skin, blood, muscle, fat and other tissues. Diseases of this pathway are generally superficial, like skin disorders, rashes and superficial swellings. I remember a patient, a military man who came from Itarsi. He had a black patch in the hand and there were no romacopas. The hair completely fallen off. Very shining one, black color. Only one line says, Vagpadacharya in Kushta Jigitsa, Prachanam alpake kushter, Shrungadyair yadhayatham. I took a lancet needle, Prachanam, started doing Prachanam without anesthesia. Military man, he can tolerate. But understand, you will not have pricking pain at all because the complete bad blood is pulling over there. So, at the third time when he came on the sitting now, completely vanished. And new hair started growing out. This practically I have seen. Acharya is no way wrong. Prachanam alpage kushte. You should not apply any what you call ointment and all that. Soframycin. Ayurvedic doctors are writing. Soframycin. What for we have studied Ayurveda then? We must apply Ayurvedic ointments. Apply, no reply will come. That is also there when you don't do prachanam. So, second is the Abhyantara Rogamarga, the internal pathway. This corresponds to the Kosha, the central core of the body. It includes all the visceral organs and the GI tract. This is the primary site of digestion and the origin point of most internal diseases like fever, jwaram, atisaram, kasam, shwasam, all are related to Abhyantara Rogamarga. The third is the Madhyama Rogamarga, the intermediate pathway. This pathway involves the deepest and most critical structures of the body. It is composed of the marmas, marayanti iti marmani, tatra maranagaritvan marmaha, our vital points, the asti, our bones, and the sandhi, our joints. Right now I have admitted an income tax officer, a lady in the the IP, and I am treating her with kottam chukkadi churnam. One lepam is there. You have to apply it as a paste. On every joint, you have got to apply it as a paste with warm takram. Why takram? Takram lagu kashayamlam. Divanam kabhavadajittam. Wonderful medicine for shobha vikaram. Whereas curd increases shobha. And you add 1/4 water to the curd and then churn it well. That is called takram. People think that you put curd, put one like this. No? Takram ready. It is not takram at all. Takram shakrasya durlabham. Even Lord Shakraha, Indra, does not get takram. We are getting it. So, what to say that this paste is applied on the joints first. Within 7 days now, she has been suffering for the past 21 years. And the third day now she says that, I feel much better. The movement is good now. Reason that churnam, it goes inside and sucks the all unwanted waters and makes space for the vayu to come out. In Urustamba we studied now. It is getting trapped by Shleshma, Meda, Ama and all that. So you release the vayu. Then only I am going for Dashamola Kashaya Dhara on the local joints, for which you should know Dashamolam. Bilva Kashmarya Tarkari Padala Tuntukair Mahat Jahet Kashayam Tiktoshnam Panjamolam Kabhanilav Kriswam Brakat Tamshamati Dvaya Gokshurakaihi Smradam Swatu Pakarasam Na Atishitoshnam Sarvadothajet where to give Brakat, where to give Lagu Panjamolam. All these are mentioned in Ashtanga Hridayam in Annaswarupa Vijnaniyam. 176th sloka. That sloka number also I can quote it from Annaswarupam. Because that is the heart of Ayurveda. And this includes the head and brain. People come to us with the head and, for example, hydrocephalus. People come with meningitis. And then Nasyam, Urdhvachatur Vikareshu. Nasyam is the great one now. And brain, the heart, and the pelvic region. For any heart ailment, please remember the sloka Vyane Ante Pratarashasya. You must give medicine only after the breakfast. You give medicine after the night food, it won't act. There is a medicine called, the latest one, Cardorium Plus, has come into the market. I correctly tell my patients, you take after the breakfast. Why? Vyane Ante Pratarashasya. We do not know the science behind it, but it is Acharya who is telling it. And Sayamashasya tu Uttarena. For any Udana Vayu Vaigunyam, for which you should know the sloka, that Purasthanam Udanasya. Nasa Nabi Galam Charet Vakpravarti Prayatnorja Balavarna Smriti Kriyaha. That in that point I will come later on to the Daivavyapashraya Chikitsa, the later session. So, how it happened, I will tell you. This pathway is very dangerous one. If it goes to the Madhyama Rogamarga, diseases of this pathway are the most serious and affect vital functions, conditions like paralysis, heart disease and severe arthritis. This classification is not just academic. It has profound clinical utility for diagnosis, prognosis, and treatment. For diagnosis, identifying the Rogamarga helps us pinpoint the location of the disease and understand the depth of the problem. For prognosis, the Rogamarga is a critical factor. There is a clear principle here. The diseases of the Bahya Rogamarga, the external pathway, are generally considered easily curable. Do you accept? Bahya Rogamarga is easily curable. Sukha sadhyam. Sarvaushada kshame dehe yunapumso jidatmanaha amarmago alpahetu agra rupa rupo anupadravaha atulya dosha desha ritu prakriti pada sampati graheshu anuguneshu ega dosha margam navasukha. All these points are noted here because they are superficial and easily accessible. I told no, pricking the skin is an easy treatment, or keeping a leech over there is easy. So sukha sadhyam. Diseases of the Abhyantara Rogamarga, the internal pathway, have a variable, easily curable, because the morbid factors can be directly eliminated, because it is there in the Koshtam, easy to do vomiting and virejanam. Diseases of the Madhyama Rogamarga, the intermediate pathway, are considered the most challenging, not only for us, for any medical system. They are often difficult to cure, or you can say krichara sadhyam, or only manageable, yapyam. What is the definition of yapyam? Seshadvat ayusho yapya patya abhyasat viparyaye. Because they affect deep vital structures that are hard to access without causing further harm. The framework, this framework also dictates our treatment strategy. For diseases localized in the gut, in the Abhyantara Rogamarga, we focus on correcting the Agni and, if needed, direct elimination. But for diseases that have established themselves in the external or intermediate pathways, our strategy must be more sophisticated. We must first employ therapies to reverse the Doshagati, bring the pathology from the periphery back to the gut, and then eliminate it. Jnatva koshta prapannamscha yatha sannam vinirharet. A disease is not a static entity. It is an evolving process that can migrate across these Rogamargas over time. Most internal diseases begin in the gut only. The Abhyantara Rogamarga, if left unchecked, they spread outwards into the Bahya Rogamarga. If the process continues, they can penetrate even deeper into the vital structures of the Madhyama Rogamarga. This progression from internal to external to intermediate represents a clear trajectory of worsening prognosis. A simple digestive complaint is easily managed. A skin rash is more complex but still highly treatable. Arthritis or heart disease is profoundly more difficult to resolve. This framework gives us a powerful tool for staging chronic illness and explaining to our patients why early intervention at the level of the gut is so absolutely critical. Before it becomes worse, treat the patients in the beginning itself. Chayeva jayed dosham, kupitam tu avirodhayam, sarvakope baliyamsam, sesha dosha avirodhatah. We have now examined all the 5 of our core concepts. Let us put them all together now. Coming to the next slide, integrated clinical analysis, integration. Yes. The true power of this model is realized when we integrate these concepts into a single coherent story of how disease develops. The causal chain from Agni to Rogamarga. Next one, please. Yes. The Ayurvedic model of pathogenesis or Samprapti describes a predictable step-by-step causal chain. This is a journey from the initial cause to the final effect, which we can map with incredible precision as shown on the slide. Number 1, Nidana Sevanam. People do mistakes here only. Nidana Sevanam. The process does not begin spontaneously. It starts with the Nidana Sevanam, the repeated exposure to causative factors. People are working in what you call in cotton industries, for example. They get asthma. Asthma is a common complaint for them. This refers to our choices in diet, lifestyle, and our response to environmental or psychological stressors that are antagonistic to our constitution. This is the initial trigger. Look at the IT people now. They work in the night time and they sleep in the daytime. That is, in Sattva Kalam, they do Tamasika Pravarti. Tamomula, Tamomayi. Ayurvedic people are very fortunate that we all sleep in the night time, I suppose. We sleep in the night now. Yes. Thanks to Lord Dhanvantari for that. And it is said that this refers to, coming to the Agni Mandhyam. Second point, people go to KFC and take an American chicken or something like, and then they go to Subway. All my students do that. Because outside the college now, every hotel is there. Right from, there is a very famous one, Talapa Kattu in Tamil Nadu. It is very famous. That is also there. These people, they go and take everything. And I'll tell them all this, they listen. Sir, listening is very nice, sir. Agni Mandhyam. The first and most immediate casualty of these causative factors is our wonderful Jatara Agni. They directly lead to Agni Mandya, the weakening of the central digestive fire, Jatara Agni, Ama formation. A weak fire cannot digest the food completely. This leads to the inevitable consequence, the formation of toxic, undigested metabolic residue in the gut called Ama. In fact, my PhD research work was in Ama only. This is the birth of the primary morbid substance. Then, step 4, dosha vitiation. This Ama is a sticky, heavy substance. It does not remain inert. It mixes with the doshas in their primary sites within the Kosha, the GI tract. This is the stage of dosha vitiation, where the doshas themselves become morbid and begin to accumulate. I asked the student, what are the 3 doshas? He immediately said, yes sir, there are 3 dosas. He went to that dosa. Yes, I said, yes, pepper roast, masala dosa. That pronunciation people cannot make. They cannot say dosas. So, dosha vitiation. This Ama, coming to the prasara, that is a step the 5th one. The Kosha is like a basin. We have a basin in the home now. When it becomes overfilled with these vitiated doshas, they begin to overflow. This critical stage of overflowing and spreading from the gut into the general circulation is known as prasara. The diseases is no longer contained now. Step 6, Doshagati. Once in circulation, the morbid doshas begin to move pathologically. This is the stage of Vaikrita Doshagati. Most critically, for chronic illness, they engage in Tiryagati, the oblique sideways movement from the central pathway into the peripheral tissues, the Shakha. Here, I remember a patient with lip cracks. Lip was cracked so badly that she appeared like exorcist. Have you seen the movie Exorcist? Like that, the lip crack was there. I was much annoyed. What to do with this? And then I tried with a medicine called Shonita Amritam. Shonita Amritam. Shonitam na blood. Amritam means nectar. The container of this, only 3 ingredients. One is Shariba. Next is Haritaki. And the third is Shunti. Continuously giving. She became all right. Finally, I applied Shatadauta Ghritam. Totally all right. Another incident here, in the Doshagati, a 13 years old girl came with a complete skin, what you call, psoriatic lesions like. And water is oozing from there. So I was really wondering what to do with this case. There is a decoction called Patola Katu Rohinyati. Patola Katu Rohini Chandana Madhusrava Guduchi Pathanvitam. I took Pitta Sleshma Pitta Kushta. Kava Pitta Kushtaha. It is very good for Kava Pitta Kushtam. Look at the age of the girl, 13 years. So she is in Kapha, Vayaha, and giving this medicine. And after taking 6 bottles of Patola Katurohinyadi Kashayam, the complete water oozing stopped. And it appeared so dry and cracked that severe pain was there that she wanted to commit suicide. Yeah, she wanted to commit suicide because the skin is pulling now too badly. Then I was making a prarthana to Lord Dhanvantari. I don't know what to do with this case. Then I asked only one question, how is your Agni? It is not very good. I just gave Kadira Arishtam. Kadira Arishtam 25 ml 3 times a day after food. Arishtam should never be given in empty stomach. After taking that, even a cine actress cannot have that kind of a skin. I tell you. She became so beautiful. So this gave me an idea how to go from the elimination process to Shamanam. Shodhanam, Patola Kadurohinyati will do the Shodhanam. Shamanam will come later on. That is a way to treat patients. So that is a step 6. He is telling there. Then coming to that 7th one, lodging. These circulating morbid factors do not settle just anywhere. They actively seek out. These doshas go in search for a weak spot. This is the stage of lodging where the doshas find a site of pre-existing kavaigunyam. That fertile ground or constitutional weakness we discussed earlier and add her there. Now sthana samsarayanam is completed. Sroto dushti. Once lodged, the pathological interaction between the aggravation of the aggressive doshas and the vulnerable local tissues begin. Now a fight will begin between the spoiled dosha and the dhatu. This is the initiation of active channel vitiation. So we all know that dushayanti iti doshaha, dushyanta iti dushyaha. There is a difference between this. And malini karanatvan malaha or sroto dushti. This is where the local environment begins to break down. Coming to the step 9, establishment. If this interaction continues unchecked, the disease process puts down roots. Like banyan tree, it puts roots. Like that, the disease will start putting roots now. It becomes established in a specific pathway, a Rogamarga. It is no longer a transient issue, but a fixed pathology with a clear location. I have a case of ILD, interstitial lung disease from Delhi. I'm sorry, I'm unable to cure the case. Failures are there. You know why? Because she is in Delhi. Agara Sambhavam Vastu. That is very important. Yeah, so Vyadhi Vyaktihi is here. This derived or this detailed 10-step process is the central narrative of Ayurvedic pathology. It is a journey from a simple causative factor to a complex structural disease, providing us with the multiple opportunities for intervention at every stage. Now, let us see how this integrated model works in practice. We will apply this entire analytical framework to 3 clinical cases. Next slide, please. Clinical case, patient profile. Yeah. Clinical case studies, a 35-year-old woman with skin patches. Let us consider our first patient. She is a 35-year-old woman who presents with a dry, rough, itchy and scaly patches on her elbows and scalp. The lesions are well demarcated. Clinically, this presentation is highly suggestive of psoriasis, which in Ayurveda is often correlated with the Kidiba Kushta. When we take her history, she reveals a crucial piece of information. She has a lifelong history of irregular bowel movements and chronic constipation. That's the case. So, let us analyze this case through our pathological axis. Kosha assessment. Her chronic constipation points directly and unequivocally to Krura Kosha, a hard, irregular bowel. Agni and Dosha inference. Krura Kosha is the classic sign of a systemic Vata Dosha imbalance. The dry, rough qualities of Vata are dominant in her case. This type of Kosha is also associated with the Vishama Agni and irregular metabolic fire. This suggests that the root of her problem begins with a Vata imbalance in the gut, leading to metabolic irregularities. What I want to say is that don't look into the modern view and an approach to the psoriasis. Come from Ayurvedic angle of thinking and look at her. Doshagati and Rogamarga. Her disease is manifesting on her skin. This is a classic example of a pathology in the Bahya Rogamarga, the external pathway specifically involving the skin and underlying blood and lymph tissues. For a disease that originates in the gut to manifest on the skin, a specific pathological movement must have occurred. This is Tiryagati, the sideways movement of vitiated doshas, primarily Vata in her case, from the Kosha into the Shakha, the peripheral issues or tissues, Srotodushti and Kha Vaigunyam, the morbid Vata likely mixed with the Ama from the Vishama Agni has circulated and found a site of weakness, a Kha Vaigunya in her skin and the blood channels. You remember the sloka, Vayur Amanvayasa Artihi, Adhamana Krit Asancharaha. One line in Ashtanga Sangraham. Vayu Amalakshanam. That is called Vata Samalakshanam. Sama means dosha with amam. is called Sama. Vayu Ramanvayasartihi Adhamana Krit Asancharaha. Unfortunately, he writes only one line. You have to understand the whole theory of all these points from there. And specifically, okay, Sroto Dushti. There it has lodged and created Sroto Dushti. The dryness and scaling are the classic qualities of Vata manifesting in the tissue. The primary channel vitiation is in the Raktavaka Srotas, because Raktam only has to carry the morbid substances into the skin, and the secondary manifestation is the skin. Primary is Raktam, secondary is the Tvak. Integrated diagnosis and treatment plan. The diagnosis is Kidibakushta with a Vata predominance, but our analysis tells us much more. It tells us that this is not just a skin problem. It is a systemic disease with its roots firmly planted in the Vata imbalance of her Kosha. Therefore, a treatment plan that only uses topical creams will definitely fail. You remember that sloka, Iti doshe vichite antaha. Anyone having the textbook of Ashtanga Hridayam Chikitsa? Iti doshe vichite antaha stvakte shamanam bahi pralayapade hitam tikshna alepa utklishtam kushtam hi vivruddhim meti maline dehe. Yes, I could understand. Remember the sloka. Thanks to my classmates. We always sit together and by heart slokas. What is the work in the hostel now? By hearting slokas. There were no WhatsApp, no Twitter, those days now. So, there is a big fight also in reciting the slokas without seeing the textbook. So, the diagnosis is understood now. It is a systemic disease. The correct approach must be to address the root cause. The therapeutic goal is to reverse the Tiriyak Gati. We must employ Snehana, because it is Tatra Ruksholako Shita Karaha. We must go for Snehana and Svedana. Do you remember the sloka that in the Sveda Vidhi Adhyayam, the last sloka? Sneha Klinna Koshtaka Dhatugava Srotolina Eja Shaka Asti Samstaha Svedaiste Dravikritya Koshtam Nitaha Samyak Shuddhivar Nirhriyanten. So Sneha Svetam are the, what you call, Purva Karma for the Pradhana Karma called Pancha Karma. So that is what Acharya is telling you. You have to give Sneha Panam. You can choose Gugula Tiktakam Ghritam in her case. Or you can take, but you cannot take Tiktakam and Mahatiktakam. Why? Tiktarasam increases Vatam. Mahatiktakam also. It is meant only for Pittam. So Guguli Tiktakam is the choice. Can we take Varanadik Ghritam? It is Kaphavada Shamanam now. You cannot take. Because Varanadik Kabham Meto Mandagnitvam Niyachati Adhyavadam Shirashulam Gulmam cha Andasavidradhim. Nowhere he states for Togrogam. Guguli Tiktakam is the direct one. Nimba Amrita Patola Nidikjikanam. Sloka is there in Ashtanga Sangraham, Hridayam. So, after giving Snehana Svedana to dislodge the vitiated Vata from the skin and bring it back to the tract, that is gastrointestinal tract. Once it has returned to the Kosha, we can administer a Vata pacifying oil-based purgation, that is called Snigdha Virejanam. Not Ruksha Virejanam. Avipatti is a Ruksha Virejanam. Can we give Mani Bhadram Lehyam here? What do you think? It can be given because it is a Lehyam now. Vidangasara Amalaga Abhayanam Palatrayam Trini Palani Kumbhat Gudasya Dvadasha Masameshaha Jitatmana Tat Hanti Ubayojyaha. very intelligently is writing that word. Masam Eshaha. Manibhadram, when you are giving to a patient, within a month, he must complete the process of virejanam. That means a single dose every day comes to 35 grams. 35 grams means 7 teaspoons. Manibhadram should be given for virejanam. Only then Kushtaroga, any skin disease will respond to your case. Otherwise it won't act. So we must dive deep into the textbook, understand, discuss with your friends, classmates, your seniors, and then come out with a proper idea of practicing the medicine. And simultaneously, we must correct her diet. What do you call that diet? Can we give curd for a skin case? We cannot. Because amlapagarasam grahi gurushnam dhadi vadayat meta shukra palasleshma pitta rakta agni shobhakarta. See that word, pitta rakta agni shobhakarta rochishnu shastamarichau shitake vishamajvare peenase mutrakrachrecha ruksham tu grahani gadena. And we should not use curd at all in the night time. Na eva adyan nishi, na eva ushnam, vasanto, ushna sharatsuna, na amudga soopam, na akshaudram, na agridam, na asitopalam, na cha anamalakam, na abhinityam, no amandam anyathanam. Everywhere he comes into the medical practice. So we must tell people, I have a student who is an IAS officer. And she is the undersecretary to the Tamil Nadu government. Soon after retirement, she came and joined Ayurveda. She never takes curd. And a regular writer in Indian Express. And she quotes all these points. She is a lover of Ayurveda. Her husband is also an IAS officer. So just for interest purpose, I am telling you all that. And the other item, brinjal. Can we give brinjal to a skin case? It will aggravate. Third, gingerly oil. It cannot be taken internally. Krishanam brahmanayalam stulanam karshanayacha baddhavitkam krimignam cha samskaral sarvarogajit. And it is achakshushyam. It is not good for eyes also. But internally, you cannot give tailam. Tilatailam, externally it can be applied, but for a skin case, tilatailam is not given internally. And the fourth important point is non-vegetarian items. If they are not properly processed, they will aggravate the skin problem. Another activity design should not sleep in the daytime. Skin cases are not, because divaswapnam, in this kind of a forum, you are not supposed to sleep. Yeah, you can yawn because you forgot to breathe by looking into the concepts. So yawning is coming, right? And so we must go for this kind of purgatives and pacify. Once ama is cleared, I think we are there only. Yeah. The fact is that, okay, let us leave that. Coming to this case, second study, yeah. A 28-year-old student with a fever, our second patient, he presents with a high fever, a significant burning sensation throughout his body, intense thirst, and frequent loose watery stools. You know what is the best medicine for this? Without going to that concept, I am telling you, Guduchyadi Kashayam. By triturating the Vilvadi Gudika in that is a wonder drug, I tell you. Guduchi Patmakarishtam, Rakta Chantana Dhanyakam, Pittasleshma Jurachardihi, Daha Trishnaghanam Agnikrittam. A wonderful medicine in Ayurveda. Guduchyadi Kashayam, you grind Vilvadi Gudika for 200 ml, 15 tablets are to be ground With the kashayam, mix it and then start giving 15 ml of kashayam with 60 ml of warm water. Also, have you heard about Bharniyadi kashayam? Bharni abda parpatakam, dhanvayavasam, vishwabhonimba kushtakana samhi amrita kashayah. That is the beauty of by hearting a sloka. You, without missing a drug, you will tell all the drugs. This is a wonderful medicine for what you call santatam, satatam, anyeddushkaha, tritiyaka chaturthakam. A wonder drug. I tried on a typhoid patient. Within 1 day, he went to office. Within 24 hours, the patient became all right. Bharniyadi Kashaya, not appearing in the textbooks, but it is there in Sahasra Yoga. And this boy came. Let us apply our analytical framework here. Kosha assessment. Frequent loose stools are the hallmark of Mridu Kosha, a soft or sensitive bowel. Agni and dosha inference. Mridu Kosha is the classical sign of a what we call systemic pitta dosha predominance. The heat, sharpness and liquidity of pitta are clearly dominant. The high fever, burning sensation and intense thirst are all classic symptoms of aggravated pitta. His Agni state is likely Tikshna Agni, an intensely sharp fire, which is the metabolic state associated with both pitta and mridu kosha. The pathogenesis of fever or jvara begins in the stomach, amashaya, with the ama formation, which then obstructs the channels, trapping internal heat. We all know that amashayasto hatva agnim samo margan pedhayacha vedadadhi jvaram doshas tasmad kurveda langhanam. The first sloka of Jvara Chikitsa in Ashtanga Hridayam, which marks the important view for all of us in medical practice. Doshagati and Rogamarga, the entire symptom complex, fever, burning, diarrhea, is centered in the core of the body. The pathology is primarily located in the gastrointestinal tract and the systemic circulation of rasadhatu. This is a disease of the abhyantara rogamarga, the internal pathway. The dosha gati is primarily adhogati, downward movement in the form of diarrhea and an upward vitiation of pitta causing the systemic heat. Sroto dushti and ka vaigunya. See how your disease is analyzed based on all these advices. The primary Sroto dushti is the Annavaga Srotas, Rasavaga Srotas and Purishavaga Srotas. The vitiated pitta mixed with the ama is causing atipravrittihi, excessive flow in the form of diarrhea and is spreading through the Rasavaga Srotas, causing the systemic fever and burning. Is constitutional pitta, nature and mridu kosha represent a lifelong vaigunya or susceptibility to this type of inflammatory pitta driven illness. Integrated diagnosis and treatment. The diagnosis is pitta jvara. If you keep the nadi, which pulse will go high? Which finger? Middle finger. Because I saw one student keeping the patient here and watching from the pulse from there, outside. I said it is wrong. Many of my students do with the left hand. It is not correct. There is a method of doing it. Any patient, I put a clothes and then only I take nadi pariksha and see. Because patients affected with hepatitis B virus and you have a small crack, there is every chance to get it into your body. Please don't check the pulse without putting a clothes. Yes, small thin cloth. We have no references. Some people may not like that. Why you don't want to touch me? I don't want to touch you. Why should I touch you? Yeah. I give you correct medicine. That is enough now. Yeah. That is the way. So, the initial step of any jwara is langhanam. Langhanam karyam ametu. We have studied now. Langhanam svedanam kalo. Yavagos tiktako rasaha. Malanam pajananisyur. Yatha avastam kramena vana. So, langhanam is the first one. Therapeutic fasting and the administration of deepana, pachana herbs. Medicines that are bitter and cooling. Why bitter? What is the bhuta ghatana of pitta rasam, sir? Pitta, tikta rasam? Vayu akasha. Vayu and akasha. Vayu akashayos tiktaha. Can you quote kshmambho agni kshma ambu tejaha ghavayuhu anilago anilaihi kramat bhutaihi maduradi rasodbhavaha. So Vayu and Akasham will go and act in the Jahara Agni to kindle that. You look into Tikta Rasam. Tiktaka Swayam Arochishtnuhu Aruchim Krimitit Visham Kushtamurcha Jara Utklesha Daha Pitta Kabhanjayetam. Daha Pitta Kabhanjayetam. Very important to underline here. And the Pitta with the sub. Once the ama is cleared, mild purgatives can be used to fully eliminate the excess Pitta from the Kosha. Can you quote the ingredients of Abhipatti Churnam? It is Mrudu Virejanam. Ashtanga Hridayam Uttara Tantram, Uttara Sthanam. Vyoshat Trijadagam Bhota, Krimighna, Amalakai Strivart, Sarvai Sama Samasita, Madhukena Gudiki Krta. Some people give Abhipatti Churnam with milk. You take with milk. Useless practice. Don't do that. Acharya never says that. He says that Madhukena Gudiki Krta. You have to make it into a small size like that with the honey and then push it inside. Abhipattir yam namna prashasta pittaroginam. The best churnam, pitta virechana dravyam is Abhipatti Churnam. So that's what he is telling here. You have to give a mritu virechanam. Can be used to fully eliminate the excess pitta from the koshta. The fact that he has a mritu koshta tells us we must be very careful. Because I remember a patient, I gave her Manibhadram Lehyam. 6 teaspoons. Because the lady now 1 spoon cut instead of 7. So I gave her. Very next day she was hospitalized. Her husband became very happy. So because he called me and said, 3 days no problems are in the house. Because always shouting and fighting. Then I said, that's not the way I want to treat your wife, sir. Unfortunately, she is in the bed. So then after coming back also she contacted me. Sir, what is the next Virejana Dravya? So some people won't leave Ayurveda, However badly you practice. That is also there. Yeah. So integrated diagnosis and treatment now. The primary Sroto Dushti is the Raktavaka Srotas. Yeah. Is the 1.5 hours over? 2 hours over. You didn't tell me. I think you are very much fascinated, interested. Though some people are yawning. Still, we have continued. Yeah. So, let us go to the last point here. Because you are all looking a little tired. But never take your tea with biscuit. Kshirena lavanam viruddham. Tea contains milk. Biscuit contains salt. Yes, a biscuit cannot be manufactured without salt. So when you put the biscuit in the chaya, then it becomes yatkinjit doshamutkleshya na hare dravyam tat samasata viruddham shuddhiratreshta shamova tad virodhibihi dravyais taireva va purvam sharirasya abhisamskritihi. Oh, I think you are doing the third line. You are preparing your body to fight with viruddha ahara. Some people take bonda with the coffee. Like that. Dangerous. Viruddhaharam. So, that's about that. Conclusion. Coming to the conclusion, the power of the axis. Esteemed colleagues, we have journeyed from the physiological bedrock of the gut to the dynamic pathways of systemic disease. We have seen that in the Ayurvedic model, these 5 concepts, Kosha, Srotas, Agni, Doshagati and Rogamarga, are not separate academic ideas. They are interrelated. They form a powerful, integrated and clinically actionable axis. The axis teaches us that the journey to chronic disease often begins with a whisper, a subtle imbalance in our digestion, a state reflected in our kosha. It shows us how a weak metabolic fire or Agni creates the toxic substrate of ama, the seed of illness. It maps out how this morbidity travels through the channels, the Srotas, seeking a pre-existing weakness, a vaigunya to take root. It describes the pathological movement, the Doshagati, by which a gut problem becomes a skin problem, a joint problem, or a neurological problem. And it provides a strategic map, the Rogamarga, that allows us to understand the location and severity of a disease, guiding our prognosis and our therapeutic strategy. This model provides a profound rationale for why therapies aimed at the gut, like dietary modification, digestive herbs, and most powerfully panchakarma, can have such far-reaching effects on scientific health and systemic health also. By correcting the imbalance at its source in the kosha, we can reverse the entire pathological cascade. It is a model that is inherently personalized, deeply logical, and profoundly hopeful. It reminds us that by listening carefully to the language of the body, starting with a simple story told by our digestion, we can understand the origins of disease and find a clear path back to health. Then, thank you for your time, respected colleagues, and for your attention here. I would be happy if at all you have any questions to ask for. Thank you. Sorry sir, half an hour extra.
Normal condition or pathological condition?
Kosha is always for helping us only. We only make it into a pathological state. It is always a physiological function where when we put all the food items in a proper way, then it acts as a good partner with us. Only when the food goes very wrong, as just stated, bonda with coffee, then it becomes a wrong pathological condition. So kosha can behave either way.
When we examine it, means a person coming having some disease and definitely his kosha is already manifested by that thing. So we can't take the prakrut kosha at the time when the person is diseased because already it is malfunctioning. So
Yeah.
we can't decide whether it is crude kosha or loose kosha or samhit kosha.
No, by thorough, see that darshana sparshana prasnaihi pariksheta cha roginam. You have to ask questions, understand. That you will definitely get a clue. When you keep on asking questions now, you get a clue there. Based on that, you have to start treating. But langhanam eva karyam, in my view, Langhanam is the pradhana chikitsa for anything. Mridu, brahmyamstu mridu langhayet. Na brahmayet langhaniyan. That sloka is very vital in medical practice.
So when we understand the Doshagati and Rogamarga, so the Rogamarga here, are we telling where the Daivavyapashraya is present?
Daivavyapashraya is
Sthana Samshraya is happening.
Yeah, Sthana Samshraya, for the dosha to happen, that is Doshagati. Now doshas are coming inside and they are searching for a place to locate. So when that searching of the dosha is called Doshagati, it is coming. Daivavyapashraya is the weak spot. It is already there. So when they find the spot, they come and get located there.
So what is Rogamarga? How do we understand Rogamarga? Because you told it is the movement of the Roga.
Movement of a dosha through a particular track. That track is 3. The track is 3 in number. One is Shakha, Abhyantara, another is Asti Sandhi.
Then what is the difference? Is it after Sthana Samshraya how the doshas are moving? That is what constitutes the Rogamarga?
Rogamarga is completed there. Now that Rogamarga is this dosha moving through the Raktam, for example. That is, Rogamarga is Raktam. And the dosha inside the Raktam is coming with the Gati, with the Vayu. And it comes to the Daivavyapashraya. It gets located there. Then Rogamarga is completed now. Now, the action between the dosha and the dhatu will start now. The interaction between these two will start happening. Then that becomes the Vyakti and Bhedam. The 5th and 6th stage.
I'm still not getting Doshagati and Rogamarga. What is Doshagati? It is understood. Rogamarga can be considered as location.
No.
Like Doshagati, the doshas are coming. So
Yeah.
what about Rogamarga?
Rogamarga is only 3. It can happen, the movement of doshas can happen in any of the tracks. In any of the tracks. Supposing it takes only the Bahya Rogamarga.
So Doshagatis are coming in that Rogamarga.
Yes. The corrupted doshas are coming in the Bahya Rogamarga. They are coming in the Bahya Rogamarga. And the Daivavyapashraya is there. They come and settle there. So the settling of the dosha into the Daivavyapashraya becomes the Sthana Samshraya. From there, it becomes Vyakti and Bhedam.
And sir, the Shaka, when speaking about Shaka, the deep-seated dhatus also is included, Majja and Shukra. So how can we consider that as easily curable?
How can we consider?
Shaka.
Shaka, Raktadaya, Stapcha, Bhakya. Okay.
Shukra and Majja is also
Yeah.
included. So that is like Shaka, Gata, Rogamarga, we consider it as easily curable.
But the Majja and Shukra are deep-seated dhatus. But how can we consider the Shaka? It can be if there is an involvement of Majja Shukra in that dhatu. How can we tell that Shakagata is easily curable when deep-seated dhatus are present? Majja.
How can we say?
How we can say it as an easily curable Shakagata?
See, for example, dosha, gati, the corrupted doshas are traveling now. Imagine a scene like, are traveling. They come to Majja. And Majja is a weak spot. Then it gets lodged there. That much only Acharya says. That weak spot becomes the Majjagata Rogaha.
It becomes Gambhira dhatu.
Yeah, definitely. Tvang mamsasrayam uttanam gambhiram to antarasrayam.
Then it becomes Gambhira dhatu.
Yeah, it becomes Gambhira. How can you say Sukha Sadhyam? Okay. Sukha Sadhyam in this case, when it comes into the Tvag Bhagaha, there also a pathology has happened. but our treatment becomes more easy by pricking like. So somewhere in some parts it is Sukhasadhi. There also he says that, as you rightly said, Majja and Shukra, it becomes Dhatukada Rogam. You have got to bring them back to the Koshtam with the Snehasvetam. What you say is right. I agree with that. Baki Rogam cannot be all the time be Sukhasadhi. It can also become Kracharasadhi. But Asti Samti is the most toughest path. Recourse, which we will explore in depth today. Yukti-Vyapashrayam, the rational, logical therapy that we are all most familiar with. The administration of diet, aharam and drugs, aushadam, based on their properties and the patient's condition. This is the realm of pharmacology, of Rasaguna Virya Vipaka. We had a beautiful session before this on this issue. Sattva Avajayaha Chikitsa, the psychotherapy, the conquest of the mind, which involves the restraint of the mind from unwholesome objects. This will be the focus of the second part of our discussion today. Next slide, please. Yes. Tribidham Aushadam, iti Daivavyapashrayam, Yukti-Vyapashrayam, Sattva Avajayaha. Tatra Daivavyapashrayam. What is that? Mantra, Aushadhi, Mani, Mangala, Bali, Upaharam, Homam, Niyamam, Prayaschittam, Swastyayanam, Prani, Padagamanam. Pranipada Gamanam. So like that, when you count, I think it will go to 12 or 13. And let us look into that. Charaka Samhita Sutrasthanam, 11th chapter, 54th sloka. So, the Daivavyapashraya, Yukti-Vyapashraya and all that, what is mantra? The use of mantras. We are not doing it now in our medical practice. But then, it is him chanting, Aushadhi, medicines in this context often burn. We put some Rudrakshamala or some bangles and all that. We put black ropes, red and all that. Money, that is precious gem wearing. In the form of, in the ring, people keep 9 and all that. Navaratna, yeah, that is right. Homam, that is sacred fire ritual. Niyama, observance of spiritual rules. Prayaschittaha, that is atonement. Upavasa, fasting. Swasthayana, auspicious recitations. Pranipada, obeisance to the what you call deities. And Gamana, pilgrimage, and so on. In this single powerful verse, Charaka outlines the entire spectrum of Ayurvedic care. Today, we begin our journey with the first of 3 pillars, the one that is perhaps the most profound, the most subtle, and often the most misunderstood. That is Daivavyapashraya Chikitsa. Coming to the next slide, please. What is Daivam? To truly grasp the essence of Daivavyapashraya, we must first look past the simplistic English translation of divine therapy. It is so much more than that. Let us deconstruct the term itself. It is a compound of 2 Sanskrit words, Daiva and Vyapashraya. Daiva is a word rich with a meaning. It can translate as divine, celestial, or related to the gods. But in a deeper philosophical and clinical context, it refers to that which is ordained by fate, that which is beyond our immediate perceptible control. It points to the unseen forces that shape our destiny. Vyapashraya means to take refuge, to take surrender in, to depend on, or to have recourse to. Therefore, Daivavyapashraya Chikitsa is the therapy that seeks recourse in these higher unseen forces to address disease. But what is the source of these forces? Ayurveda provides a clear and unequivocal answer called karma. So karma is the main point here, which we will go to the next slide. Yes. At its core, Daivavyapashraya Chikitsa is a therapy designed to address ailments rooted in Purva Janma Kritam karma, the accumulated effects of deeds performed in previous life. This is not a vague or superstitious notion. Our texts provide precise definitions. The great commentator Chakrapani, in his Tika on Charaka Samhita, defines Daiva with unerring clarity. He says that Swakrutam Apariharyam Avinashi Paurva Daihikam Daiva Sapnyakam Anubandhikam Karma means actions performed in the previous life which are apariharya, unavoidable, avinashi, that is eternal, and anubandhika, that is continues into this life. That is why we are all sitting here, because something is there behind, that we should all become an Ayurvedic expert and come over here and talk on these issues. And these are all known as Daiva. So, here the nature of this karmic casualty is laid here. It is apariharya. It cannot be sidestepped or avoided through ordinary means. It is avinashi. Its impression is eternal until it bears fruit. And it is anubandhika. It follows the soul from one life to the next step, waiting for the opportune moment to manifest. You can see some people get a white patch somewhere in the body and it rapidly spreads. Till the age of 30, 35, no problem. On a fine day it starts, on a bad day I should say. And then it rapidly spreads. This is called Daivam. And the Charaka Samhita itself, in the Sharira Sthana, further solidifies this link between past deeds and present disease. Nirdishtam Daiva Shabdena Karma Paurva Daihikam Hetus Tadabi Kalena Roganam Upalabhyate. Charakacharya quotes, the deeds of a previous life which are indicated by the word Daiva also become a cause, hetu, for diseases at a particular time in this life. Next slide please. Yes. This framework is of immense therapeutic importance. It does not negate the present life causes. It simply adds a profound layer of understanding for suffering that defies conventional explanation. Consider the conditions we label today as idiopathic. We say cause unknown. We say idiopathic, congenital. It is Kulaja Vikara or Sakaja Vikara, like that we say. Because parents are okay, but the child is an autism child. What is the reason? And or inexplicably resistant to treatment. For a patient suffering from such an ailment, the lack of discernible cause, that is known cause, it is lacking here, can be a source of immense psychological distress, a feeling of helplessness in the face of random affliction. Daivavyapashraya transforms this helplessness to hope. By attributing the ailment to karma, it shifts the condition from being a random, meaningless event into one with a defined, albeit unseen cause. This act of providing a casual narrative is the first and most crucial step in this therapy. It restores a sense of agency and hope, offering the patient a structured path of action, a specific set of remedies where none seemed to exist. It is a powerful psychological intervention wrapped in a spiritual framework. Coming to the next slide, please. The principles of action. Yes, how does it work? Having established what Daivavyapashraya is, we must now ask how it works. Why did our acharyas place this therapy first? Not that giving medicine is first. Daivavyapashraya is first. And even before the rational administration of drugs, the commentator Chakrapani again provides the rational, highlighting two key characteristics of this therapy called Ashukaritva. Daivavyapashrayam is Ashukaritvam, quick in action, and Akleshakari, non-distressing or causing minimal discomfort. Let us hear his words on its primacy. Atra Daivavyapashrayam adavat uktam ashu vyadhikaratpena. Here Daivavyapashraya is mentioned first because of its ability to relieve disease immediately. And again, in another context, he says that Etacha pradhamam uktam sadyo akleshena cha vyadhi prasamakatvat. This is mentioned first because it pacifies the disease instantly and without causing discomfort. How do that? By doing Daivavyapashrayam, do we see a relief of the patient immediately? Do you think that the white patches will come down immediately? We don't see that. But there is an explanation for that. What he is giving here. Now, a rational mind question this concept of instantaneous relief. How can a ritual or a prayer cure a deep-seated disease instantly? The genius of the acharyas lies in their understanding of the psyche. The concept of Ashuka Aritva here may not necessarily imply an immediate biological cure, because white patch doesn't appear immediately. Rather, it refers to the immediate psychological relief and the profound shift in the patient's internal state. Internally, the patient is satisfied by all this. So, he is creating an environment suitable for our therapy next. So, that comes in Daivavyapashrayam. Imagine an individual grappling with the fear, anxiety and despair of a severe or chronic illness. For example, cancer you take. Then when it comes, people have fear, despair and all that. The very act of engaging in a sacred ritual of chanting a powerful mantra or of making an offering provides an immediate pacification of this mental distress. A cancer patient gets a relief when we conduct Homa Karma or Bali Karma or Mantra Visheshaha. That's what Acharya is telling here. And he says that of making an offering provides an immediate pacification. It transforms the patient from a passive sufferer into an active participant. After that, you give any medicine now, he will love to take that. In their own healing, this engagement instills confidence, reduces stress, and creates a favorable internal environment, a psycho-neuro-immunological state that is conducive to the body's own recovery. A recovery which is often supported by concurrent Yukti Vipashraya therapies. It is a quick buck because it addresses the suffering of the mind, which is often the most acute aspect of any illness. Here I want to stop and tell you an incident that happened in my clinic practice regarding Daivavyapashrayam. A patient, the left side of the eye has become totally blind. and he had only a partial vision of the right eye. Then he has gone to all post pillars in allopathic system and he had no recovery. Then I told him that you take Triphalam Madhusarpibhyam Nishi Nettarabalaya. You take this medicine at night bedtime. Next day morning at the time of sunrise you chant Arya Dvadashakam Veda Mantram. That you can see in YouTube also. It is there. Arya Dvadashakam Veda Mantram. If I start chanting it, it will take 5 minutes. Udyan Adya Vivaswan Arohan Uttaram Divam Devaha Hridrogam Amasoryo Harimanam Chashunashayatu. Udyan Adya. Like that it starts. It takes a long time. In fact, I chant it daily. Daily I chant it. After Sandhya Vandan, we go for 108 Gayatri Veda Mantra, doing all the rituals properly. At 4:30 in the morning, Brahma Muhurtam, we all get up and then do that. So, when I conveyed this message to him, he went to the Arya Dvadashaka Veda Mantram along with Triphala Madhusarpihi. You know that, to a great surprise, he had a vision recovery. By chanting this continuously, he was surprised, he was amazed. I told him, why don't you take this message to your allopathic doctors? Let them all listen to it. So it has an immense effect. But at the time of sunrise, we should do that. Imagine that. And also, we are go to the next slide 10. Yeah, the power of Prabhava. Correct. The second principle concerns the mechanism of action. How do these therapies bypass the known physiological pathways? Because any medicine you give, it has to go to the Jatara Agni, get assimilated there, and the Viryam, Prabhavam have to travel across the blood and then go to the liver, spleen and all act. But this Daivavyapashrayam trespasses the Jatara Agni. It will not touch Agni, but it will have an immense effect on the system. And the mechanism of Daivavyapashrayam is described as achintya, inconceivable, and is said to operate through prabhava, an unexplainable specific potency of an action or substance that transcends its discernible properties. I want to stop here and give you another example in my medical practice. A boy who was studying in the 5th standard, he was brought to my clinic, and his father said, my son is the idiot of idiots. Sir, please look at him. Sir, he looks very nice, I said. No, sir, in appearance he is okay, but in studies he is the last bench fellow, sir. He does not study anything proper. Then I said, you please go to that Yunjyad Ananna Mannatav Madhye Ante. What is the sloka? Madhye Ante Kabalantare Grase Muhussannam Samudgam Nesicha Ushadham. And you travel to Pranavaka Srotas now. Grasa Grasantayoho Prane Pratushte Madarashvini. So Prano Aptara Murdhakaha Urak Kantacharaha. In that I think Buddhi will come. Chitta Indriya Drik Shtivanam Kshapatu Udgaram Nishvasa Anna Praveshakrita. Leave alone all is fine. You take only Buddhi and Chittam. So, a boy who is idiot of idiots, he must be given a medicine in between each bolus of food. Grasa Grasanta Yoho. You have to give. Then I gave a medicine called Saraswata Churnam. Saraswata Churnam mixed with the Saraswata Ghritam, mixed with the honey, and asked his mother to give in between each bolus of food. Let us see how it acts. Because I wanted to test Vagbhada Acharya also. Acharya itself we want to know. So by giving that, I told him to chant a Veda mantra from Rudra Yamalam. It is for Lord Subramanya. It is only 28 Namavalis are there. If I start chanting, it will take time. It is called Prajna Vivardhanakyam Kartikeya Stotram. It is there in YouTube also. That also you can see. So I told that and the boys started chanting it. And now, because in the name of the 20 Tamavalis, a word will come in the beginning, in the middle. Saraswato Guhaha. He is called Guha. And Saraswataha. He is the Subramanya Swami is meant for intelligence. People who chant that will never forget slokas. And you will complete all your PG art, PhD art on just like that. I never thought I would complete my PhD. Because I am an idiot of idiots. So I was thinking about. So I had to take all the help of Subramanya Swami. Make a Nitya Prarthana. Please complete this. And then I could complete it. That is called Prajna Vivardhanakyam Kartikeya Stotram. Yogishwaro Mahasenaha, it starts. It is there, na? You can see that. So, and this boy now working in Mumbai as a refrigerator, repairer. Up to that he has come. Yeah, not not like that. But he has completed. IT, he went there, what is it called? Diploma course. And now he is working. His father is so happy. Because the son is not dependent on the father now. So, this is another incident that I want to narrate here. Also, one more thing is there which I will tell you. If time permits, we will look into the third one, important aspect. Coming to the next one, we are in Prabhavana. Okay. While rational therapy, Yukti-Vyapashraya, relies on the pharmacological properties of substances, their Rasaguna-Virya Vipaka and their interaction with the digestive and metabolic fire, the Jatara Agni. Daivavyapashraya is believed to operate on a much subtler level. It bypasses the gross physiological pathway to directly influence the karmic or energetic blueprint that underlies the physical manifestation of the disease. The commentator Shashi Lekha on Ashtanga Sangraha articulates this principle with beautiful clarity. Tatra Daivavyapashrayam yat papasya upaghatakatvenaiva jataragni samyogena vina dhadu samyakaram mantra aushadhyati. That means he says it trespasses Jatara Agni and it goes to the subtler level of the body and acts somewhere to make people alright. Daivavyapashraya Chikitsa is that which has a significant impact on the papa, sinful acts done by the person and causes dhatu samyatva, equilibrium of tissues without the involvement of Jatara Agni. It includes mantra, aushadhi, etc. This is a critical distinction. We are not working on the body's chemistry here. We are working on its underlying energetic and karmic matrix. No biochemical, because modern medicine, MBBS course you see, they approach only to the biochemical complex of the body. It is only Ayurveda which goes beyond and it will act upon the energetic matrix and karmic matrix. We are addressing the source code of the illness, not just the malfunctioning software. Body is the malfunctioning software. We are not going to that. We are addressing the source code here. And next slide, please. The methodologies, a deep dive into the practices. Now, let us turn to the specific methodologies that constitute the Daivavyapashraya Chikitsa as enumerated by Charaka. These are not a random collection of folk remedies, but a structured multimodal system designed to influence the patient's internal state and external environment simultaneously. Next slide, please. Mantra Chikitsa. Yes, Mananat Rayate iti mantraha. At the forefront of Daivavyapashraya, it is mantra chikitsa. A mantra is not merely a word or a sound. It is a sacred, energized formula. The very definition of mantra is there in the board, manana trayate iti mantraha, that which protects trayate through its contemplation, mananat. It is considered a form of adravya aushadhi chikitsa. There is no medicine we give here. A non-material medicine of immense power. Our texts are replete with the examples of its use. And indeed, our cultural and spiritual practices are built upon this foundation. To truly appreciate its depth, let us examine some of the powerful stotras that serve as extended, potent mantras for health and well-being. First, let us consider a stotra for removing obstacles and negative influences, a direct mitigation of unfavorable daiva. That is called Rinamochaka Mangala Stotram. You can see the Rinamochaka Mangala. What is Mangalam? What is the Graham? Mangalam. Angarakam. Angaraka is Mars. Please think about Mars planet for a minute, because we have a beautiful view of that. And that mantra also daily I chant. In that, it is said that Mangalo Bhumiputrasya Rinaharta Dhanapriyaha Sthirasano Mahakayaha Sarva Karma Virodhakaha. The third line is beautiful. Lohito Lohidakshasya Samaganam Krapakaraha. That is Shukracharya is telling that you are having a red eye and you are Lohita Akshasya. That is, you are fully red in color. Americans sent that item na, and now they say that it is a red planet. See, Shukracharya has written many yugas ago, and he says that a man who chants this Veda mantra will never have a debt. DEBT. You will, if at all you are paying any debt for house loan or something, if you will chant this daily, your debt will get cleared quickly. In my case, it happened. I could complete my house loan very quickly and come out of. If at all you have any debts, even for a two-wheeler also or a car, please chant this. Lokito lokidakshascha samaganam krapakaraha dharatmacha kucho bhomo bhutito bhuminandanaha angarko yamaschaiva sarva roga apaharakaha vrishtehe karta. Why I am telling this now? You go to Kushta Chikitsa. In later part it is coming. In Kushta Chikitsa, there is a context appearing in one line word, a sentence. There is a Vayasa Janga Moolam. He is taking one root. And Vamani Patram. 2 drugs are taken. And he tells us that to grind that with the takram, with the buttermilk. Make a paste and apply it on the skin where the problem is there, itching, burning and all that. You apply this paste on Tuesdays. Bhaumavare. He says, he does not prefer Wednesday, Thursday, Friday and all. On Tuesday you apply, the patient will have 100% recovery. Acharya challenges that in Ashtanga Hridayam, Chikitsa Sthanam. That is why I am telling you, this sloka, which is for the Mars, is connected deeply into our Shastras. So, and also, Mantra Chikitsa, let us consider that Rinamochaka Mangala Stotram is the prime example. While ostensibly for removing the debt, in a deeper sense, it addresses the karmic debts, because we have karmic debts also that manifest as suffering and disease. Next, for the direct purpose of healing specific ailments, our tradition gives us hymns like the, as I told you, what you call Arya Dwadashaka Veda Mantram, and the ultimate source of life and health. It was composed by Samba. Samba was a bear. That bear had what you call that eyesight was totally lost. And so he approaches Lord Krishna and then requests, I have this problem, please solve. I am not the person to solve it. Then, my dear Samba, you chant this Arya Dwadashaka Veda Mantram, then the sun god will send you a golden leaf in that palm leaf. In that this Veda mantra will be written. You read that. So when he sent it, he could see this Veda mantra and read it, and his eyes got recovered. So this is a story in the, it is there, and so that is, I stress upon that again. And coming to the next one, Dharani Garbhasambhutam Vidyut Kanti Samaprabham, again for Mangala Stotram only. And because sir is telling that time is very limited. In that Arya Dwadashakam, you will come across two important lines. Tvachidosha Hridosha Ye Akhilendriyaka Doshaha Tan Pusha Hatadoshan Ishad Rosha Agnina Dahatun. This is a powerful Veda mantra. Any skin ailment will get cured by chanting this. And any heart ailment, all cardiologists must tell to their patients this one. So, this stotra is a master class in Daivavyapashraya. It links a specific deity, Surya, with the healing of specific diseases to be recited at a specific time, reinforcing the connection between celestial realms and human health. Finally, let us examine a stotra. This I told you that Sri Kartikeya Stotram, and also that is over. And coming to the next one, yes, coming to the Vamana Chikitsa, you can see Panchakarma people are here. While giving the Vamana Dravyam for Panam, before that, one Veda mantra is chanted. Brahma, Daksha, Ashvi, Rudrendra, Bhuchandra, Arka, Anila, Aghada, Analaha, Rishayaha, Saushadhigrama, Bhuta Sanghascha, Pantuvaha, Rasayanam iva Rishinam, Amaranam iva Amritam, Sudheva, Uttama Bhaishajyam Itamastute. Directly it is coded in Ashtanga Hridayam. In Sangraham also it is there. May Brahma, Daksha, the Ashwins, Rudra, Indra, Bhumi, Chandra, Arka, that is sun god, Anila, my wind, and Anala, fire. The sages, the entire community of medicinal herbs, and the hosts of beings protect you. Like the Rasayana of the great rishis, like the Amritam, nectar of the Devas, like the Sudha, nectar of the great Nagas, may this medicine be up unto you. So this is a chanting. After that, the patient drinks the Vamana Aushadam, that the Vamanam will happen very clearly. Coming to the next slide, Dravya based modalities, the power of worn substances. Mani Dharanam, gemstone therapy. This involves wearing specific precious gems. Traditional sources cite wearing pearls to reduce fever symptoms or other gems to counteract negative planetary influences. You also we have studied Graheshu Anuguneshu, Egadoshamargo Navasukhaha. And also in that Tyagaha Prajnaparadhanam, Indriyopashamaspritihi, Deshakala Atmavijnanam, Sadvrittasya Anuvartanam, Adharva Vihita Shantihi, Pratikula Graha Archanam, mentioned in our classics. And what is that? They emit specific energies or subtle color vibrations that can influence human physiology and consciousness. Aushadhi Dharanam, wearing of the herbs, amulets. This is the practice of tying potent herbs in an amulet. Herbs like Vacha or Hingu are worn as a protective measure, raksha, what you call, raksha karma, especially for infants, to ward off unseen negative influences. See, when a child is sick in the home, they conduct one homam and they throw the mustard in the fire. The mustard will fly to a distance, say about 10-12 feet and it will fall there. Up to that area, the evil spirits will not enter. Up to what level the mustard goes and flies, from there they have no entry. They cannot enter. It is said like that in many areas of Kaumara Bhrityam. It is said like that. And so, Agadam, the antidotes. This refers to the use of herbs and other substances that are antagonistic to poisons. These may be worn, used in rituals, or applied externally to neutralize toxicity, working through their prabhava. Time up, sir? Time is up. Okay. So like that, we keep on, lot of slides are there regarding Daivavyapashraya and Sattva Avajayaha. Ma'am may be interested because she is doing a research in that, no? Yeah. You can take the slides, you can take them. And Homa, Yajna, Bali Karma, Upavasa, all that details are available here. We are only in section 4 now. Clinical applications, how to do that. Karmaja and idiopathic disorders, psychiatric and psychosomatic illnesses, all these being addressed in our Shastra. And how to go for Balagraha Chikitsa, specific somatic diseases in Kushtam, and all that. Just now we have discussed about it. So, Sattva Vajayaha takes another 1 hour. Slides are there. Anyway, I thank all of you from the heart of hearts.
Slides will be shared in the group. Okay. So detailed slides will be there, no? So that will be shared in the.
Yeah, but my speech details won't be there. Yeah. But it contains all the details. You can also take that. I can give you.